Take this moment during a recent Senate hearing on reopening schools in the United States and this exchange between a Republican senator and the country's top infectious diseases doctor.
As much as I respect you, Dr. Fauci, I don't think you're the end all. I don't think you're the one person that gets to make a decision. We can listen to your advice, but there are people on the other side saying there's not going to be a surge and that we can safely open the economy.
And the response.
I have never made myself out to be the end all and only voice in this. I'm a scientist, a physician, and a public health official. I give advice according to the best scientific evidence.
But this public health advocate explains the two disciplines are intimately connected.
If we adopt a political lens to looking at the COVID-19 response, it's often a fairly nationalistic response, one centered on country first before thinking about this collectively and globally. The scientific response, though, has been one of collaboration, of solidarity, of sharing knowledge and information. So in some ways, it's a clash of these two ideologies, one centered on self-preservation and the other on collaboration. And I think finding a middle ground in these conversations, leaning, of course, towards collaboration and solidarity, is probably where we need to head toward.
But it's the middle ground that finds itself in the constant crosswinds of a public health emergency and the dire socio-economic conditions it has wrought, and the understandable pressures political actors who lead the response have to grapple with.
It's an incredibly hard question to answer because even the scientific conversations have been in some ways polluted by the politics. I don't think that there is any vaccine development process currently taking place that hasn't been politically affected. For instance, there are over 100 vaccines currently in development, 10 of which are in human trials. And of those 10, we've just learned that 6 are in China. And so the Chinese response, for instance, to the vaccine process is inherently a political one. It's centered on Chinese political ideology, and that's certainly going to affect the way in which the scientific response plays out. So politics and science, I think, are intrinsically connected, and it's difficult to separate it.
Acabou, porra!
In Brazil, the right-wing President Jair Bolsonaro has taken a brazen anti-science response, clashing even with his own health ministry as infections and deaths soar. British Prime Minister Boris Johnson boasted about shaking everyone's hands until he landed in ICU, while the United States reached the tragic milestone of more than 100,000 deaths just this week from a virus President Donald Trump famously said would be gone by April.
I could put it a different way, Dr. Fauci or President Trump?
I would always support a Dr. Fauci approach compared to a Trump approach. I think that he has been handling this crisis in a much more even-keeled way, one in which takes into consideration the collective. And given his history in dealing with pandemics in the past, I would certainly put my money on Dr. Fauci.
A debate where doing the right thing doesn't always mean it feels like the best thing for everyone. Add human nature into the mix,
PPE every day,
and it becomes a discussion that's likely to rage on. Sherwin Brycebees, SABC News, New York.